everybody, welcome back to my channel. My name is Corin, also known as the Kitten Choreographer, and I'm a teen with a passion for animal rescue and, in particular, kitten rescue. Hi, Sunny. So today we are talking about helping kittens with twisted legs. A little bit of background on this is I got a mama and her 4 newborn babies about almost 2 weeks ago. So that we have Mama Sunny and her 4 flower babies, Lotus, Buttercup, Sunflower, and Azalea. It was not until like a couple days ago that I started noticing that their legs were just a little bit weird. They weren't quite in their right positions, and their legs aren't twisted all the way around or anything like some kittens with twisted leg syndrome, but their legs are just a little bit funky, and I'll be showing them in a minute. You can see these are what normal legs look like. These kittens are only a few days younger than the guys that have the twisted legs, and so you can definitely see their legs are pretty much directly underneath them because eventually they're gonna need to walk with their legs underneath them, you know? But I'm gonna now show you these guys to show you that their legs are not normal. Be warned, they're going to scream. They really don't like me. This is Sunflower. This is one of the guys with the twisted legs. You can see his legs. You can see his legs are not directly underneath him. They should be about here, but instead they splay outward. Like this. Sorry, I'm looking in the viewfinder to make sure I'm showing you. So those are his legs. I'm gonna put him down so he stops screaming, but you can notice his legs are twisted outward. Now, I have not been to a vet, so I do not have a direct diagnosis, but this could also be swimmer syndrome, which is a condition where the legs splay out and they look kind of like they're swimming. I think that's why it's called that. Oh, hi, Smee. Smee's right behind me. Now I'm going to show you the second kitten that has it. His condition is less extreme. You can see his legs still splay outwards when they should be in, like this. Now we're going to show the last kitten who, in my opinion, has the most extreme case. You can see these are his natural position of the legs, which is incorrect. One of his legs splays out, and one of his legs splays kind of in, like this. It should, one more time just showing you, be directly underneath him. So now I'm going to be just giving you a little bit of information about this syndrome. So having a kitten with twisted leg syndrome or twisted legs often means that they actually have contracted tendons. This usually is due to like bad positioning in the womb where they're just in a wonky spot or a wonky position for an extended period of time. This happens most likely in big litters, like litters of 6, 7, 8, or just in litters where the mama has a small uterus. Because 3 kittens in this litter have it, I'm assuming that Mama Sunny has a small uterus. This can affect multiple kittens, like in the case of this litter, or it can still affect singular kittens. I do want to state here that this is not a deformity. This is not a defect. This is a condition. Basically what I'm trying to say, twisted leg syndrome in and of itself is not a deformity. Although there are some similar deformities that present themselves looking like twisted leg syndrome, which we'll get to in a minute. Twisted leg syndrome can affect kittens' front legs, hind legs, or like a mixture of both. In this case, and in this video, we will be focusing on hind legs because as you saw with those kittens, they all have something wonky going on with their hind legs. Don't worry, right now I'm just giving you general information, but I will go into the treatment in just a second because this is a lot of the time, fortunately, a correctable condition. I'm gonna go ahead and pop up a picture of a kitten named Charlotte. This is a foster I had over the summer. She may look like she has this syndrome, but she actually has something called radial hypoplasia. These conditions look very similar, but one is a birth defect and one is a condition. Radial hypoplasia can present itself and can be in different ways. I don't even know if that makes sense, but in Charlotte's case, it meant that she had some bones missing in her front legs, so her legs went in like this. Her condition was not correctable because it was radial hypoplasia and she was actually missing bones, and her legs could not be bent into their correct position. However, twisted leg syndrome is different, and while it can look similar, it is different because it is not a birth defect, and with treatment, it can be corrected if treated young enough. The way I personally told the difference in knowing that this was not radial hypoplasia was that, like I said, Charlotte's legs could not be moved into normal position, but their legs, like you saw in the beginning, they can be moved into a normal position. This is a condition that I do suggest going to the vet if possible, preferably a vet that works with neonates often and conditions like special needs frequently. Some vets you may go to might just be, oh, it's a genetic mutation. They should just be euthanized. When that's not the case, it can be corrected. And even if it was a genetic mutation, they could still live wonderful lives. And like I said, this is not a deformity. However, if it is left untreated, then it can become a permanent deformity. So that's why it's definitely best to hop on the treatment right away, which I'm going to be getting into right now. So let's talk about physical therapy. Like I said, treatment needs to begin as soon after birth as possible. As soon as you notice the mutation in the kittens, or as soon as you get the kittens, if they're a little bit older, treatment needs to begin. There are pretty much two types of treatment. The first type of treatment is physical therapy on the kittens, and the second type of treatment is like a brace for the kitten. I said that really fast, I'm sorry. But you want to start with the physical therapy and then move on to the brace if physical therapy does not correct it. However, because I did discover that they had this condition relatively early, they're only about 2 weeks old, I'm hoping that this can be corrected with only physical therapy and that we won't need to brace these guys. But we will see, because this video won't be posted until their legs are normal. I will show you how to do the physical therapy in just a minute. We'll go into the other room because Sunny gets very mad that her babies are being messed with and they scream. Even though they're not in pain, she gets mad. Physical therapy can be done 3 to 10 times a day for up to 5 minutes each session. For me starting physical therapy, I started it yesterday. I'm currently doing it 4 times a day, 3 minutes per kitten per session. Okay, now let's go ahead and move out into the other room and start the physical therapy. Okay, the first part of physical therapy is you're gonna wanna make sure the kittens are warm. These guys are always on a heat pad, so they're always warm, they're nice and ready. Next, you're gonna wanna start massaging the legs. I kind of just rub them, get them kind of loose, get them not so tensed up, because these guys are prone to tensing up when a stranger, even though I'm not strange, I'm not their mom. You know, when someone picks them up, they're just really tense. That's what the point I was trying to get across. So I'm just massaging his back legs, and I don't really spend too long on this. I'm not gonna set a timer currently because it's probably gonna take a little longer than usual to explain it, but I normally set a timer for 3 minutes. The most important part of the physical therapy is stretching and flexing the legs. So you can see his wonky legs, and what I do is I stretch it out, I kind of wiggle it a little bit. He doesn't like this, but it's not really painful for him. And then I just pop it, not pop it, but like I just move it into the position that is correct for his legs. You can see his leg splays out. We want it to go in. So I just stretch it into position, slowly just moving it, kind of mimicking as if this leg was walking. I just stretch, stretch, and then I do the other leg too. I don't know if I mentioned this is the most important part of the physical therapy, just moving their legs into the position. And I did start this last night. Hopefully I'll be able to come back in like a week and there will be some progress and their legs will be partially back to normal. And I kind of just like fake walk it out, bend it. Sometimes I put him on my lap and just like move both legs at once on my lap, on his back, and just move both legs at once into position, kind of as if he was walking or like moving his legs back and forth. Let's talk about bracing a little bit while I'm doing this. For bracing, you don't need to do it until the kittens start kind of walking on their own, which is normally around 3.5 to 4 weeks. These guys are only 2 weeks, so I'm hoping that when they're about 3.5 weeks, they have mostly normal legs, so you don't have to brace them. But I recommend bracing with medical tape. I don't know if I'm going to show this in my video, like I said, but I am going to link a helpful video down below in the description that Kitten Lady made on her kitten with swimmer syndrome and how she did medical tape on her legs to like return them to normal. So basically what I do is I do this for 3 minutes, like I said, with every kitten at morning, lunch, dinner, and bedtime. I basically, you know, just do it. Like I said, the stretching, it's a pretty simple process. It's very repetitive, just like stretching their legs and massaging their legs into place. They really hate it. He's actually the quietest out of his siblings, believe it or not. His siblings scream bloody murder. But you just stretch it and hopefully I'll be able to come back in a few days to a week and show you some progress with these legs. See you in a few days to a week for me, but just a few seconds for you. Alright people, it's been about a little over a week actually, and I thought I would show these guys progress. They've been making some really great progress. Buttercup's legs I think are pretty much normal at this point. Lotus's leg, one of his legs was twisted in, now that leg seems normal. They're still in twisted out kind of, but it's a lot better. And Sunflower, his legs are a little bit twisted in. His legs are a little bit corrected from where they were, but I think there's still some room for improvement. So I'm right next to their setup that they're currently in. I had to put them in this setup because Sunny is a weirdo and she was kind of just hissy at me, and Mickey and Minnie needed more socialization anyways, so I moved them into my room. That's Lady in the background. She got spayed, she separated from her babies because I don't want them trying to nurse on her. I'm going to get out Buttercup first. I think Mommy just pottied them because he's kind of wet. You can see his legs are a lot more normal now. They're not out as far as they were. They're in a good bit. I'm still doing a little bit of PT on him just because I'm wanting to make sure they stay that way. I'm gonna put him up because he's really loud. but they are definitely a lot better than they were. Now I'm going to show Lotus, who has a piece of poop on him, and he's got poop stuck to his bum. I'll have to clean that in a little bit. So you can see his legs. This is the leg that was turned in previously. You know, it was kind of turned in. Now it is completely normal. It looks totally great. I'm super glad. I think the PT really worked a lot. And you can see this leg is still turned out a little bit. It's turned in a little bit, which is good. So I'm just gonna keep doing PT on this leg, hopefully for a few more days, and then if it still hasn't improved or really gotten better in a few more days, I'll start taping. Sunny hasn't been cleaning their bums well, so I've been trying to clean them, but I need to clean them again. I just came in here and didn't think to look at their bums, so ignore that. But Sunflower, his legs are still kind of turned out. Oh, lady, of course you gotta show us your litter box skills. But I think he has improved a little bit. You can see his legs are in a good bit, but if you look, you can't really see that, but if you go and kind of press them into position to see how he would walk, they're still a little bit twisted out. So I'm gonna continue PT on his legs too, and I will see you again in a few days, either for the outro saying that their legs are doing great, or I will see you back for taping. I'm really hoping their legs will continue to improve with the 4 times a day PT, but we shall see, we shall see. Okay, you all, so it is time for the final update for these guys. I had basically said that I was gonna come back in like a few days to a week to tell you like what the game plan was. Well, it has been several weeks. These guys are like 6.5 weeks old now, and the reasoning for that is because I got busy and I just did not get around to filming this portion of the video. It turns out that these guys pretty much were able to have their legs. Oh my goodness, you are covered in poop. Hang on. Pause, please. Okay, so Buttercup just had poop all over him. He just didn't do a good job cleaning his bum. So I just had to get that real quick. Nice and annoying. I was planning to show you all 3 of their legs, or like all 3 guys' legs, but that's not gonna happen because Buttercup had too much poop on him and I probably need to give him a bath. This is Sunflower. So what happened was basically after a week or a week and a half, I'm not sure how much, of physical therapy, their legs were completely corrected and I did not have to tape. So I am sorry for the people that like have really bad twisted leg or swimmer syndrome in this video because you just won't see the taping from my video. I'm sorry. I will try and link a video down below of Kitten Lady taping a kitten with swimmer syndrome so you can learn how to do it from her. But basically I'm going to show you their legs now. Let's start with Sunflower. So this is Sunflower. You can see his legs are completely underneath him. They look kind of not from this angle, but they are. He can walk perfectly. They're completely underneath him. He is all better from his condition. And you have poop on you too. Thanks, you guys. He definitely is not as bad as Buttercup, but he just has some litter stuck to his foot. Okay, so I need to clean him up better too, but I will show you, he's a really chill kitten, but I will show you his legs. You can see their natural position is now in, but not as in as that one leg was, just like how they're supposed to be. So I hope this video was just helpful in learning about swimmer syndrome / twisted leg syndrome. I did never get to go to a vet for a diagnosis, so I'm not sure. And here's Julia. She was one that was never affected. Basically, that is it for today's video. I hope it was helpful. Thank you so much for watching. If you like this video, make sure to like it and subscribe for more makeup and kitten related content. I upload on Sundays and Wednesdays, and if I cannot upload then I upload whenever I want to. Thank you so much for watching again, and goodbye!